everyone, this is a demonstration video on how to properly clean up hazardous drug spills, including chemotherapy spills. Hazardous drug spills must be contained and immediately cleaned by qualified personnel wearing appropriate personal protective equipment and using the contents of a spill kit. Spill kits are readily available in all areas where hazardous drugs are routinely handled. Please familiarize yourself with where spill kits are located. All hazardous drug spills that can be completely cleaned by the use of 2 spill kits, which equals approximately 2,000 milliliters or 1,000 milliliters per spill kit, are defined as containable spills. These spills should be cleaned up immediately by a caregiver at the scene of the spill. All hazardous drug spills larger than 2,000 milliliters are defined as non-containable spills and will require additional resources to manage. Please ask your supervisor for area-specific instructions. In addition to large volume spills greater than 2,000 milliliters, non-containable spills also include spills of hazardous drugs that produce gases or vapors and should be handled according to non-containable spill procedures. It is important to familiarize yourself with the contents of the spill kit. The following items are contained within most spill kits, including those used at the Cleveland Clinic. Each spill kit will have 1 poly-coated maximum protection large blue gown, 1 pair of large and 1 pair of extra large latex gloves, 1 N95 respirator mask designed to protect from solid particles or non-splash liquids. This respirator does not provide protection against gases or vapors. There will also be 2 large yellow waste bags, 1 pair of safety glasses with side shields, 3 disposable spill towels, 1 pair of shoe covers, 1 caution chemotherapy drug spill sign to alert others of the spill, 2 Chemo Plus pads for liquid spills, and 1 scoop and scraper. Here is a step-by-step approach on how to appropriately manage a chemotherapy spill. Step 1. Assess the size, scope, and type of the hazardous drug spill and follow your area-specific policy for additional assistance if needed if the spill is deemed non-containable. Step 2. If the spill can be managed by a caregiver at the scene of the spill, retrieve 1 to 2 spill kits and set the caution chemotherapy drug spill sign to limit access to the spill area. Step 3. Put on the appropriate protective equipment in the following order. Select the correct type and size of gloves and insert hands into this first set of inner gloves. Select a gown and unfold it so that the opening is towards you. Put your arms in the sleeves. Hold your arms high so that the sleeves fall over the arms and fasten the gown, and then ensure that the inner gloves are under the gown cuff. Then don the safety goggles for eye protection and the N95 respirator mask for respiratory protection. Don the shoe covers and then insert hands into a pair of outer gloves and ensure that the gloves cover the gown cuff. Cuff both yellow chemotherapy waste bags and place on the floor adjacent to the spill site. Carefully remove any broken glass fragments and place into yellow sharps container. Scoop and scraper can be used for this purpose. Carefully remove any broken glass fragments and place into yellow sharps container. Scoop and scraper can be used for this purpose. For liquid spills, contain the spill by laying a Chemo Plus pad over the spills. The pads will absorb the liquid and transform it into a gel to assist with disposal. For powder spills, absorb powder with damp disposable pads or towels. As a tip, proceed from areas of lesser to greater contamination, working outside to inside. Detach scoop and scraper and use both to pick up the chemo-absorbed gel, being careful not to contaminate gloves, and place gel into one of the yellow chemotherapy bags. Use the absorbent pad, soap, and water to pick up any remaining gel and place in the same yellow waste chemotherapy bag. Using the contaminated hand, use water-dampened absorbent towels to rinse the area. As a tip, only use one hand to directly clean the spill area and exposed surfaces. Wipe the area with soap-dampened absorbent towels using an inward circular motion. Place the absorbent pads into the yellow waste chemotherapy bag and repeat process 3 times. Then use Paradox RTU solution on absorbent towel to use it to clean the area. Discard contaminated absorbent pad in yellow waste chemotherapy bag. Additionally, rinse the area several times using water-dampened absorbent towels and allow the area to dry for 15 minutes. Place all remaining materials for containment into the yellow waste chemotherapy bag and seal it. Once that's completed, remove all personal protective equipment except the inner pair of gloves and place all removed items into the second yellow waste bag and seal it. Dispose this as bulk hazardous waste in the approved black bin. Then remove inner gloves from inside out and place in sealable chemotherapy bag. Place into the appropriate yellow bin for trace hazardous waste. And finally, perform hand hygiene using soap and water. After that's all completed, please report the spill to your supervisor and through SIRS.